Let us now discuss an interesting area of third-party reproduction, the first and foremost and the commonest in use being egg donation. There are several indications for egg donation. As I told you in the earlier sections of poor responder, premature ovarian failure and premature menopause, these were some of the main indications for egg donation. We also know there are patients who repeatedly fail IVF cycles because of poor quality eggs and embryos. They would also sometimes need to resort to egg donation. There are women who are above the age of 41 or 42 with an extremely poor ovarian reserve on serum AMH or FSH testing who would also be candidates for egg donation. So you have several indications besides the young girls with premature ovarian failure, elderly women who are above the age of 40 with a depleted ovarian reserve, patients who have repeatedly failed IVF cycles, and patients who have bad quality eggs on IVF. Most of these patients would finally end up with an egg donor program. It is important that the clinic should have a good tie-up with a ART bank. We now have specialized ART banks who provide the sperm donors, the egg donors and the surrogate mothers. Egg donors need to be screened as per international standards. It is important to make sure that the egg donor is young, in very good health, not a carrier of any disease, needs to be tested for thalassemia, sickle cell anemia, other anemias, also needs to be tested for sexually transmitted diseases such as HIV, hepatitis B, hepatitis C and syphilis. Once they pass the screening procedure, the patient could also be interested in matching some of the other characteristics with the potential egg donor. The egg donor is then stimulated in the same way as an IVF patient. The eggs are retrieved. At the same time, the patient who is going to receive the egg donation also needs to be prepared. Her uterus would be prepared with a combination of estrogen and progesterone pills to make sure that it is at optimal receptivity to receive a good quality embryo. When the embryos are prepared, they are then transferred to the recipient. Success rates are extremely high in the tune of 50 to 60% per cycle, and patient with a good endometrium, a good uterus, could usually expect a pregnancy within 2 cycles. It is important here to remember that a clinic should not misuse technology. As per the guidelines laid down by the Indian Council of Medical Research, our clinic insists on an age limit of 45 for the woman, which is important to follow because of social, legal and ethical considerations to the children who will be born out of such technologies, especially if done at a very late or advanced age of the female partner. A very interesting application of egg donation in our experience has been for patients who have lost offspring in some kind of tragedy, a swimming accident or a car accident, grown-up teenage children. It is really tragic in these patients. Most of them are then in their early 40s, have lost their egg reserve, but they can still have a child with resort to egg donation and in vitro fertilization.